Yoddly doodly. I'm Beth Simmons, and you're watching Now That's What I Call Community Health. Joining me for this countdown this evening is Nurse Paige. Thank you for joining.
Thank you, Bert.
So, Nurse Paige, how have you been?
Well, I've been feeling a little crappy, but the best thing to do is talk about it. 7.6 of persons 12 years of age and older are diagnosed with depression in any 2-week period, and on average, 8 million ambulatory care visits for major depressive disorder occur annually.
Wow. What other kinds of mental health disorders are there, and who are affected?
Well, depression is the most common type of mental illness, affecting more than 26% of the adult population. Others include schizophrenia, bipolar disorder, and obsessive-compulsive disorder, just to name a few. Risk factors for these illnesses include genetic susceptibility, brain chemistry, personality, and life events.
That is staggering information. Is there stigma against these individuals?
Unfortunately, there is. Only 25% of adults with mental health symptoms believe that other people are caring and sympathetic to people with a mental illness.
Wow. Well, what do you do as a nurse?
Well, it's important to educate mental health patients and their families about their illnesses, as well as the public and the community about these patients' experience on a daily basis to reduce stigma. The Department of Health and Human Services website is a great resource for finding support systems in your community and available services for mental health issues.
All right. Well, with that takes us to number 6 on the countdown by Don't Dwell. And the song is Crappy.
Suicidal thoughts when you're feeling pain. At rock bottom, your joy goes away. If you're feeling weird and out of place, be aware you need some help. You can find your way. When you feel crappy, call your mom. If you feel like jumping off the roof, when you feel crappy, call your nurse. If you hear voices talk to you, when you feel crappy, you are strong. If you call the therapist for treatment too, when you feel crappy, don't feel wrong, you're not alone. Many are affected too. You sing the blues when your affects last. Yeah, well, it's not the norm, don't have to be like that. Yeah, reality's distorted, you'll be just fine. Friends care, they got you on their mind. Be wise. When you feel crappy, call your mom. If you feel like jumping off the roof, when you feel crappy, call your nurse. If you hear voices talk to you, when you feel crappy, you are strong. If you call the therapist for treatment too, when you feel crappy, don't feel wrong, you're not alone. Many are affected too. Come on, bring you down, don't let nothing bring you down unless you're mannequin high. Bring you down, don't let nothing bring you down unless you're mannequin high. Bring you down, don't let nothing bring you down unless you're mannequin high. Bring you down.
Well, that song wasn't crappy. It actually lifted my spirits. That takes us to number 5, which is about a very, very prevalent issue in our country. It's about addiction. Nurse Paige, how prevalent is this issue?
Well, in 2011, an estimated 20.6 million people over age 12 in the U.S. had some sort of addiction. Also, 100 people per day die of overdose, and 5 million ER visits happen a year in relation to drug addiction.
Wow. How does it affect people with health, specifically?
Well, drug addiction weakens the immune system, causing a higher susceptibility to infection, as well as lead to chronic diseases such as cardiovascular disease, liver failure, stroke, and also birth defects.
So, what drugs are abused the most?
Well, National Drug Early Warning System identified binge drinking, heroin, and hydrocodone as the most commonly abused drugs, with numbers of cocaine users on the decline.
Some of those are even prescription. That's very interesting.
Mm-hmm.
What's being done about it?
Well, Healthy People 2020 is really focusing on reducing the number of adolescents who use drugs and alcohol and increasing the number of adolescents who both recognize the risks of abuse and disapprove of drugs in general.
Okay, that sounds good. What's the nurse's role in this?
Well, nurses need to educate on the benefits of rehab and answer questions like how much it will cost, if insurance will cover the stay, and where they can go in their community. They advocate for patients while in rehab, during withdrawal, and when they want to give up. Also, it is extremely important that nurses follow up with these patients, connect them to support groups,
Oh, yes.
and then transition them back into everyday life.
That all sounds like good things that nurses are doing.
It is.
All right, well, with that, jail Celly with Prefix to Addiction.
Now usually I don't do this, but go ahead on and give him a little info about addicts. I'm not trying to be rude, but hey, that stuff is killing you. The more illicit drugs you do, you're gonna be hooked really soon. You think it's just one little pill, and that high that you feel, even smoking one little roach, it's a gateway to something real. You can go to AA, you can go to NA, you can go with your bro. It's a judgment-free zone. Don't you stop and sell liquor. It's a prefix to addiction. Cooking meth in the kitchen. Johnny rolling that doobie got every dude in here itching. Sniffing on coke and numbs. I'm like, so what? I'm buzzed. It's the freaking weekend, baby. About to get me some drugs.
And that was jail Celly with Prefix to Addiction at number 5. Let's talk about sex, baby.
Let's! Did you know that there are 20 million new sexually transmitted infections every year? In fact, 1/4 of the people infected with HIV in the US don't even know it.
That's insane! Aren't they preventable?
Absolutely. But since so many STIs don't show symptoms, people often transmit infections without realizing it, even if they are trying to be safe.
If they don't show symptoms, what's the point in being safe about it?
STIs aren't just about smelly junk. They cause infertility, cervical cancers, poor pregnancy outcomes, and even death.
Death. Well then, how can somebody be safe?
The first step is education. Getting tested is important, even if you only have one partner. People tend to think that it won't happen to them, but there isn't any shame in getting tested. STIs are no different than any other infection, and there are many treatments available.
When I was in school, they used to tell us, if you have sex, you will get pregnant and die.
Yikes. Luckily, there have been many changes in school curriculums all over the country to help improve the quality of education in grade schools. The CDC has found that there is insufficient evidence showing that abstinence-only education is an effective intervention for adolescents.
Then what is an effective way of educating kids?
Well, a recent study found that including sex education in the middle school biology curriculum can be an effective way to teach adolescents about STIs because they can better understand and remember the biological mechanisms of transmission. 15 to 24-year-olds comprise half of all new infections every year, so educating our youth is vital towards decreasing new infection rates.
Wow. Well, I heard HIV isn't a death sentence anymore. Right?
Yes, the most common sexually...
But what about other STIs, though?
Well, the most common sexually transmitted infection right now is HPV.
HPV? Can't you get a vaccine for that? I wish they had that when I was younger.
Yes. The vaccine is recommended for 11 to 12-year-olds and is most effective if they are provided before an individual ever has sex.
So, what are you doing as a nurse now to help promote safe sex?
Well, nurses can do a lot. For one, we can bring educational services to at-risk neighborhoods and provide condoms, sterile needles, and syringes, and education or literature about testing services. We can also identify STI trends in the population we serve to screen at-risk clients and adequately plan prevention programs and illness care resources.
Alrighty. That is all great information. And with that, we're gonna go to number 4, S.T.I with Condom Style.
Rapid condom style. Condom style. 90s are gone, but HIV can still infect ya. That burning pain you feel, get checked, it might be gonorrhea. You might think no symptoms, but it could be chlamydia. Just be safe, let someone see ya. You're invincible. What you don't recognize is that infection's everywhere. It's worth it to protect your zone, cause you don't wanna scare. If you don't wrap it up and do the deed, just be aware. You just be aware. You should get tested if you are active, just so you know, and your partners know. Don't be selfish, don't wanna spread it, not tomorrow. Keep the status quo, and in the end it's better that you know. Rapid condom style. Condom style. Rap, 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 rap. Rapid condom style. Condom style. Rap, 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 rap. Rapid condom style. Hey, don't get lazy. Rap, 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 rap. Rapid condom style. Hey, don't want babies. Rap, 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 rap.
And that was S.T.I with oh my goodness. How did that get there? That was S.T.I with Condom Style. S.T.I. Oh. Well, we are nowhere near wrapping this up, folks.
See what you did there.
Yes, yeah. There are still many, many topics that the community needs to learn about. Mm-hmm. One of the most important, coming in at number 3 on our countdown, is immunizations.
Right.
What is it that is important to teach these families about immunizations, since they affect everybody?
Yes. Well, it's important to dispel myths responsible for stigma about immunizations. Mm-hmm. Many of the false claims regarding the danger of vaccines is a direct result of the falsification of scientific reports.
Yes. And these scientific reports you speak of, what was this issue with this Wakefield report that I heard about?
Well, this was first seen with the MMR vaccine following the Lancet publication of the 1998 paper by surgeon Andrew Wakefield.
Okay.
And colleagues that linked the combined MMR vaccine to autism in children. Mm-hmm. So this publication used by figures such as Jenny McCarthy to promote anti-vaccination propaganda was used.
Well, last time I checked, she wasn't a doctor or a scientist.
No.
No. So, what would you like to say to these people listening to, say, Jenny McCarthy and refusing to get their children vaccinated?
Well, first of all, vaccinations is one of the greatest life-saving developments in human history. So they have led to the eradication of smallpox, the near eradication of polio, and a reduction in measles deaths of nearly 80% since the year of 2000. Herd immunity also requires 95% adherence of a population to prevent outbreaks. So those who decide not to vaccinate are increasing the likelihood of a major outbreak.
Okay, so it all sounds so important. What do we do, and what do you do as nurses to get more people vaccinated?
Great question. Well, the CDC found that the strongest predictor of adults getting vaccinated is the recommendation from their healthcare provider.
Like you as a nurse.
Exactly. Okay. So it's important to build trust with your patient so they value what you have to say about vaccinations.
Yes.
Also, the CDC website has many easy print handouts that educate specific demographics such as older adults, pregnant women, travelers, and healthcare workers, among others.
Yes. Oh, I like it when people put stuff in picture form. Yes, definitely.
Yes.
Okay, well, with that, here is Lady GABA with Blame Game.
No, I don't want your vaccine tricks. I want to run away from your needle stick. I heard those things will make you sick, and ain't nobody really got time for that. I wanna teach you all about this from immunizations, yeah. No autism or influenza from the vaccinations, just a little aching, yeah, aching, yeah, aching, yeah. Ooh, now just listen, just wanna teach you for a minute, maybe 10 seconds. A pinch is all you're gonna feel. This doesn't make you sick, it's only gonna keep you protected. McCarthy's not a scientist. Talk to a nurse before you refuse this. Don't play the blame game, play the blame game. Do you want shots or you wanna deal with the real thing, yeah? Immunize, yeah. Don't play the blame game, play the blame game. Do you want shots or you wanna deal with the real thing, yeah? Immunize, yeah. Turn down, always start the same with cheap complaint and a place of blame. My friend's son is autistic and I know vaccines are to blame. Blame, 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 a blame game.
Oh, we're back. Oh, sorry, we're back. All right, well, that was Lady Gaga with Blame Game. And, moving on. We have a special guest in the studio today, don't we, Nurse Paige?
We do.
This next song is one of my personal favorites by Sick No More and Try and Do This. So we have Sick No More joining us today. Everybody put their hands together.
Hey.
Hey, Sick No More. Hey, oh, hi.
Oh, hey.
Okay.
Get nice and cozy.
Yeah. So, Sick No More and Try and Do This, their new song is called Health Stop. And it's about chronic diseases. Why are chronic diseases something that we need to teach patients about?
Well, disease self-management and health education are important preventative measures for patients because it can help reduce mortality and morbidity rates and improve the quality of life for chronic disease sufferers. And these conditions account for the most deaths in the healthcare costs in the U.S.
Oh yes,
That is true.
Yes? So break it down for me, these stats of these chronic diseases and such.
Well, 45% of the population have at least one chronic disease.
Oh my goodness!
Yes. Chronic diseases are responsible for 7 out of every 10 deaths in the U.S., killing more than 1.7 million Americans every year.
Oh wow, this is a good topic to take on there.
Yes.
Sick No More. Okay. And
If I could just interject.
oh, perfect. Sorry.
Well, they also account for 81% of hospital admissions, as well as 91% of all prescriptions filled,
Okay.
and 76% of all physician visits. And by 2025, chronic diseases will affect an estimated 164 million Americans, which is nearly half of the population.
Oh wow. These are pretty preventable though, right?
Yes, the US CDC estimates that eliminating 3 risk factors, including poor diet, inactivity, and smoking, would prevent 80% of heart disease and stroke, 80% of type 2 diabetes,
Okay.
and finally 40% of cancer.
Wow. All right. And what is your role as a nurse?
Well, the nurse is the biggest advocate for the patient, and with the trusting relationships that we develop, we educate and support the patient in prevention, treatment, and aim to increase their quality of life for all suffering from these chronic diseases.
Well, this is one of my favorite songs. I'm very happy to have
Thank
you
you.
here. Sick No More.
great.
All right, with
Thanks.
that, it's Sick No More and Try and Do This with Health Stop.
my lungs so costly. Breaking my finger down, that blood sugar's wonky. No one takes it back, I keep addicted to the nicotine. Not only do I sink, now I got COPD. Didn't know there's a link with smoking in my arteries. Probably should have stopped this to make sure my heart beats. Near miss. But if you really think it kinda makes sense. Coughing it, hacking it, about to get some prescription meds. Passing out streptococcus and the units been strapping in. Tummy feels funny, suck it up, I'm dreading retracting and wasting my money. I'm so unhappy that's a burden. I'ma take this treatment trial, No, for real, ask Obama, can I have his hair marked down? STD boots and some sock slippers. Awesome scams on chemo while cancer's got me wigging. Wish I hadn't ignored, now I'm on this backboard. Under just this blanket, now I'm on the surgeon's board. Hello, my surgeon, my fellow. This pain can't get no relief from this narco. I could take some morphine, make a script to go. Department heads would be like, that's how healthcare goes.
What makes my health bad? Only got one body in this lifetime. I'm hunting, looking for some info. Prevention, something awesome. Yes.
Oh man, that song is good.
It was good.
So
It was
good.
good.
All right. And finally, we're coming to one of the most controversial and important topics in America.
Yes.
Obesity.
Yes.
Nurse Peterson. What is it? And why is it being described as an epidemic?
Well, Bert, to put it simply, the state of obesity is when you have too much body weight for your height.
Okay.
And more than 1/3, or 78.6 million
Million.
of U.S. adults are obese.
Million.
But this is not just an issue with adults.
No?
No. Approximately 17%, or 12.7 million children
Million!
and adolescents, yes,
Million.
aged 2 to 19 years are also obese.
Wow.
Yeah.
Those are some staggering statistics.
Yeah.
But what's so bad about being a little bit chunky?
Well, unfortunately, obesity has been linked to the development of many chronic illnesses.
What, do you just like Sick No More talked about those ones?
Exactly.
Okay.
Which include diabetes, cardiovascular disease,
Okay.
cancer, depression, infertility, respiratory distress,
Wow.
and musculoskeletal disorders.
Oh my goodness.
Yes, and children who are obese are more likely to become obese as adults,
Okay.
and the diseases that they develop are more likely to be severe.
That makes sense. That makes sense.
Yeah.
By golly, that is horrendous.
Yep.
And how do people become obese?
Well, a non-balanced diet and lack of physical activity
Okay.
are the
Couch
main
potato.
yes,
Okay.
are the main factors that contribute to people becoming overweight. Unfortunately, it affects some groups of people more than others due to food availability. For example, African Americans consume on average 33% more fast food than Caucasians
Okay.
and are a third more likely to be obese.
Oh, okay. So no more Mickey D's, I guess.
Yeah, no more.
Alrighty. What's being done currently to battle this epidemic?
Well, the best way to combat obesity is to prevent it by teaching people the importance of a good diet and exercise.
That totally makes sense.
Makes sense, right? Even kids can understand making healthy choices as early as pre-K. So there are many programs aimed towards kids in order to educate them as they grow.
Okay. I heard that the Obamas were getting involved.
Yes.
Obamas.
Yes, they are. The First Lady actually launched the Let's Move program to teach kids about exercise exactly. Doing it already. There is also a great program called My Plate
Okay.
that teaches about making healthy food choices and the importance of portion size.
All right. Well, isn't that nice of the Obamas?
Yes.
So, as a nurse, what is your role?
Well, so nurses influence a large population of their peers, patients, and visitors, and can have an impact on neighboring communities. And this makes an important asset for obesity prevention efforts as a whole.
Yep, all right. Well, and with that said, the #1 song for 57 weeks in a row, maybe because it affects 78 million people, I don't know.
I don't know.
#1 by Gwen CHOBANI, Junk Food Snack Girl.
Hear me spit. All the girls on these sweets like this. A few times I ate a pudding pack, but I'm not just gonna get fit like that, 'cause I ain't no healthy snack girl.
Look at nutrition facts, girl. Don't need to have a heart attack, but I'm not just gonna get fit like that, 'cause I ain't no healthy snack, girl. Look at nutrition facts, girl. Ooh, I'm kinda thick, must get fit. Ooh, I'm kind of thick, must get fit. Ooh, I'm kind of thick, must get fit. Ooh, I'm kind of thick, must get fit. Guess what my dietitian teaches? Apples, oranges, pears, and peaches. Fruits and veggies make you thinner. Burger with no bun. So I'm eating right, gonna give it my all. Seldom alcohol, no chocolate fondue. That's right, my eating habits changed. My tummy's not robust. Smell the honey barbecue rack, but I'm not just gonna get fit like that, 'cause there ain't no healthy snack, girl. Look at nutrition facts, girl. Can't I have a silver dollar short stack, but you're not just gonna get fit like that, 'cause there ain't no healthy snack, girl. Look at nutrition facts, girl. Ooh, no more chips, no more dip. Ooh, pick up your hips, the scales no tips. Ooh, and if you slip, just recommit. Ooh, and if you slip, just recommit. Get fit, eat bananas, BANANAS, to fit your pajamas, PAJAMAS. Get fit, eat bananas, BANANAS, to fit your pajamas, PAJAMAS. Let's get fit, let's get fit. Let's get fit, let's get fit.
Well, that Gwen CHOBANI, she is so good looking.
Super
Okay,
talented.
Super talented.
Hands down.
Super talented. Well, this has been my favorite presentation thus far of
By
Now
far.
That's What I Call Community Health Topics. Nurse Paige, thank you for joining us. Thank you in the audience for joining us. Thank you for coming late, Kaden. I am having such a great day. Good afternoon, good evening, and good night.